Hi, this is Mayor Maureen Brosnan. You know, we've been hearing a lot lately about the coronavirus, and so we wanted to take a moment today to just spend some time with our Director of Emergency Management, Kahn. Brian has been with the city, and his primary responsibility is to make sure that, number one, we're prepared for emergencies of all varieties, and that number two, that we're able to bring you the information as quickly as possible when and if an emergency situation should arise. So today, we're spending the afternoon here at our Emergency Operations Center, which is in the basement of the Livonia Police Department. And I've got Brian with me today, and we're going to answer some of the questions that we've been getting from Livonia residents about the coronavirus. And I want to just start with some basic prefacing remarks. You know, we've seen a lot of panic in our local media and in the coverage nationally of what's going on with the coronavirus. But the fact of the matter is we still do not have a reported case here in Michigan. So we're asking everybody to remain alert, remain aware, but use common sense in managing this coronavirus. So we've got Brian with us, and we're going to start by asking him some of your questions. So Brian, one of our residents wants to know, how has the city prepared for the likelihood of the coronavirus if and when it is discovered in our community? How prepared are we for that?
Well, our preparedness actually goes back a little ways. Livonia in and of itself is a standalone emergency preparedness city. We work directly with the state and with our county governments as well as the federal government for this. Our preparation relies on a lot of plans that we have, and we have had plans in place for several years, if not decades now at this point in time. Part of the planning process is working with our partners to determine what would be the best way to address this type of hazard, or really any hazard that would befall the city itself. In particular with the coronavirus, we would work with our partners, being the health department, whether it's Wayne County, the state of Michigan, or CDC, to determine what would be the best action if something were to occur here for this. Now, as we see the coronavirus itself ramping up a little bit, we've been in constant contact with them. That is all part of our planning process. So our plans establish that interoperability with other people throughout not only the city, but the state, the county, the federal government itself.
Okay. I had some time recently spent with you just as incoming training for new mayors to learn about that communication system. And it really is impressive in terms of how much data we have access to as a community. And I was trained in that regard. A lot of our city employees have been trained. Our department heads have all been trained. Other members of the city council have been trained. So I think that we come at this very well prepared. What are your thoughts about how well prepared we are?
Well, I think we're very well prepared. We've always been taking that proactive measure. Again, it's not waiting for something to happen. It's part of the planning process of getting ahead of the game, so when something does happen, we're already a step ahead and moving in the direction if something were to occur. You're correct. With the Michigan, it's a management system that we have. Part of what we do is that, as I said before, the interoperability and discussing with our partners what we can do and how we can do it and linking to them directly. And we do this through this management system.
Yeah. And I think you've made it clear, too, on a number of occasions that we take our direction from the state of Michigan, from the CDC. It's going to be those organizations that alert us when and if the time arises for us to really take action and open up, for example, the Emergency Operations Center to its fullest scale. Can you talk to us a little bit about what that might look like?
Sure. As you know, Mayor, we partially opened up the Emergency Operations Center at this point in time, and a lot of it is for the communication. It's that direct link we have with the state of Michigan. They've opened up their state of Michigan Emergency Operations Center, and it's a lot of monitoring at this point in time. As things ramp up or scale up, or if we have something occur in the city of Livonia, a lot's going to be determined by the Michigan Health Department, the Wayne County Health Department, the Centers for Disease Control. In what they're going to do, they're going to allow us, or at least talk us through what we need to do and how we need to report this.
Great. So another resident wants to know who exactly has been trained in our critical incident management system, that system that we just got done talking about. I've been through the training,
Yes.
You've been through the training.
Yes.
Who else specifically?
A lot is redundancy, so we
Okay.
always want to make sure redundant. So there are people that would back my position up, in particular other employees here in the city, fire department, police department. So those individuals, there's a lieutenant here at the police department, a captain at the fire department, department heads. people that would have an operational stance within the response to whatever the emergency is. In this particular case, the operational response to the coronavirus itself or the health issues that may come up. So you're talking to fire chief, the police chief, Department of Public Works, the boots on the ground, so to speak, department heads.
Great. Another resident wants to know what type of incident or report would trigger the activation of the opening of the EOC, the Emergency Operations Center.
Again, we've partially activated right now, so it's that monitoring. It's the states triggering when they opened up their state emergency operations center to monitor and talk with their partners locally down at the municipal level, to the counties, to the state, to the health department, to the federal government. That triggered our partial opening of the EOC. So we are currently open in a monitoring situation.
Okay. And a full open would be triggered by?
Probably it would really depend on the situation itself and how the extent of the virus and the health concerns that we might have. Full opening might be if we had a large outbreak, say in the city of Livonia, required maybe schools shutting down, city departments shutting down. That full opening would then have all the department heads coming in to determine how do we want to handle this, what are we going to do if we need to shut down various departments in the building, or other private entities maybe start shutting down too.
Great, good to know. Given all the information that you've been reading on the virus, what do you recommend that residents do?
Well, you had said it best, first and foremost, is not panic with this. We've been through this before. We've seen this come and go before. This is just part of today's time. So it's taking that logical approach to everything and how we handle it, and looking for reliable resources on information, whether it's the city, it's things like this, and maybe contacting their health departments or their state health department, the CDC, to look at everything and get a good picture of it, a scientific picture of it. Common things that we do every day, making sure that we wash our hands, making sure that we wipe down surfaces, making sure that we cover our mouths when we cough. At this point in time, there's, like you had said, there's really no cases in Michigan, so it's making sure that we just do standard hygiene protocols.
Okay. Stay home if you're sick.
Correct. Right? Absolutely. Absolutely.
Right. Just the basics is what we're being told right now, and we're hoping that people are following that. I know there's been a run on hand sanitizer, and we as a city have stocked up.
Yes.
We've got a couple big events coming up in the city, so we want to make sure that we've got an ample supply, and we do. We're ready, right?
Oh, absolutely. We're 100% ready behind this. And a lot is just, we've prepared for this, something we've planned for. Even prior to this, we were doing exercises with the Wayne County Health Department, planning for situations such as this. So we would be that step ahead of things. And we do have the hand sanitizers and the gloves and everything that we need to get through this. And I'm sure we'll get through this.
I think that should give people a great deal of comfort to know that we've trained, we've tested ourselves, and we are hopefully not going to see this become a huge outbreak, and that it'll be managed appropriately. So, and finally, where are people supposed to look for information and updates? A big part of your job and our city's job is to make sure we communicate with our residents so that they're not always having to look for information elsewhere, that we bring it right to them.
Correct.
How do we plan on doing that?
Through the city's website, probably the easiest. If not, we can go to the Wayne County Health Department's website, the state's health department website, or the CDC directly. Those are the big ones I recommend. Those are the, I don't want to say factual, but they are the factual places we want to seek this information out. If they have any other concerns, I'm sure they can call myself, somebody in the city, and we can direct them to that. If they don't have access to the internet, we can find ways to get them access or to get the information to them.
Brian, we have a Nixle system in place too that also alerts people when there are emergencies or things in particular, storms that are coming. It reports those on a frequent basis. Would we activate that system? We
could. Depending on the circumstances itself. Currently, I would suggest everybody subscribes to Nixle. It's easy to do. It's you just go to the Nixle website, you subscribe to it. It walks you right through it, and you put in your zip code, and you will get information from the city when we put it out. Otherwise, our Facebook pages are a great source of information too. We will push information out as it comes. We have a lot of different avenues to get information out to people, especially as things escalate or they start getting a little bit more worrisome. We'll make sure we get the information out to the people.
So when we think about it, we've got our city website, We've got our Facebook page, we have Nixle, we have our Livonia television station, which carries information too. We have a Livonia radio station as well. So we'll be sure to make sure that everybody knows what those 5 access points are.
Yes.
But they're always active, they're always carrying the most current information. So I think folks ought to be able to tune in readily and find what they need.
Absolutely.
Awesome. Well, that's good. So I think we got it as under control as we possibly can right now without any further advances.
Correct.
But our pledge to the community always is that we're going to be on top of it.
Yes.
And that if anything does change, we're going to do our very best to bring that information to people first, right?
That is absolutely true. Absolutely true and correct. And we'll make sure we push as much information out to people. To be quite honest, it's to have people as prepared as they possibly can too, because the more they're prepared, it helps us out at the same time. So we want to make sure we get that information out to people.
Good, good. I'm glad we got a chance to talk to you today. We thank you for tuning in and for staying alert, and we will do our very best to keep you up to date. Thank you.